Hello, everyone. I'm here at Fire Station 4 in downtown Los Angeles on this very rainy day, and certainly we could use the rain. But we are here to mark an important step on our path out of this pandemic. And let me start by thanking the folks who have been tremendous this entire year. The men and women of the Los Angeles Fire Department, who together with volunteers from CORE have stood up the best testing program anywhere in America and continue to be on the cutting edge of not only providing relief, transporting patients, invoking telemedicine to help people remotely get health care, but also to be on the cutting edge of making sure that their personnel are safe. We're here today, Chief Terrazas and I, to observe some of the first doses of the COVID-19 vaccine that will be administered to the men and women of this fire department. Folks who themselves have gotten sick. We've lost members of this family this year to COVID, and we want to make sure that those who are on the front lines exposing themselves to danger are the ones that we protect under the protocols of the vaccine first. These are the folks who are always there for us, not just during COVID, but when any disaster strikes. Whether it's a fire, whether it's a medical emergency, we know that these men and women are the folks that are literally angels in our city of angels. These are the folks who will be trained as well to administer the COVID-19 vaccine, starting with our frontline healthcare workers who have worked so hard, have sacrificed so much in 2020, and are working shift after shift after shift even today. For this effort and this moment is a bright spot in what has been the most difficult year of our lives. I know it might not feel it on a cloudy day like this, but these are rays of sunshine coming through the dark clouds that we are living under. And as we see, this is our darkest moment. Here in Los Angeles County, the numbers continue to tick up. While not at the rate of the last couple months, they continue to increase nonetheless. About 14,000 new cases of COVID-19 each day, 88 deaths a day, and our hospitals and our emergency rooms are strained to capacity and running low on critical supplies. We're at a breaking point right now, which is why it is so important for these vaccines to roll out as quickly as possible. And it's important for all of us to make the right choices. Hopefully everybody made the right choice for Christmas, and I would ask everybody to do the same thing for New Year's. I know for some of you it's not how you usually celebrate New Year's, but it's how we must celebrate New Year's, so that we don't get a bump from Christmas, a bump from New Year's, and a surge that simply overwhelms our capacity to serve people at risk of dying. With extended friends and family members, it's a choice that you can make that will either save lives or take lives, and I know that you will do the right thing. This is a very painful time. It's a scary time if we're honest with ourselves. And some of us are so tired we don't want to hear or see the bad news all around us. We think the worst time was at the beginning of this pandemic, when it actually is right now, this moment, right here. So at a moment when we're kicking off the long road to recovery through vaccines, this is a bright spot for us to close out the year. So last Tuesday, the Los Angeles Fire Department received 3,200 doses of the Moderna vaccine. With about 3,400 personnel, firefighters, and workers in this department, it allows us to administer a first dose to virtually everybody. And we kicked the program off on Saturday. The vaccine will be distributed to firefighters and paramedics from this site and two other fire stations in Watts and in the Valley. So Monday, Tuesday, Wednesday of this week, we'll do half the battalions, and then Monday, Tuesday, Wednesday of next week, the other half of the battalions. And my office is also very intimately involved with the county to open 3 COVID vaccination sites for healthcare workers as well. We are on the subcommittee for equity of our vaccine task force at the county level, ensuring that no community is overlooked simply because of its geography or its zip code, its income level, or cultural background. We're going to make sure that those frontline workers can get a vaccine in their neighborhood where we see cases up the most. Those healthcare workers and first responders have been there for us. It's time for us to be there for them. This is the reason that Los Angeles has led the nation when it comes to launching free public COVID-19 testing back in March. The first city to offer that for folks without symptoms. And it's because the leadership of Chief Terrazas and his men and women and the dedicated, hardworking folks in uniform that they have fought and will continue to fight to save literally thousands and thousands and thousands of lives. No matter how many deaths we count, we can't count the deaths that didn't happen, but we know that they are there, and we are so deeply grateful for that gift of life. But we all have a role to play, too, in preventing our emergency rooms from getting overwhelmed. So continue to do your part, wearing your masks, limiting your non-essential activity, using the tools that you have to keep safe and healthy, maintaining a distance. And if you think you might have been exposed, please get tested. We're closed for Christmas Eve and Christmas Day. We'll be closed for New Year's Eve and New Year's Day, but otherwise we're open for business. And we have 5 drive-through and 5 walk-up locations throughout the city, and over 100 places you can get tested in LA County. It's free to all people in LA County, regardless of where you live. And altogether, we have a testing capacity in the city sites of 46,000 tests per day, and we've administered 3.2 million tests to date. So let me now turn it over to Chief Terrazas. I'll come back to say some words in Spanish, but I really want to thank him, whether it's testing, whether it is the ways that we have innovated on healthcare. This is a life-saving department, our Los Angeles Fire Department, led by our Fire Chief, Ralph Terrazas.
Thank you, Mayor Garcetti, for your kind words. Today marks the beginning of the LA City Fire Department's COVID-19 vaccination program. In the next 2 weeks, we will have offered vaccinations to all of our 3,400 firefighters who have been on the front lines of this pandemic since March. To date, more than 600 firefighters have tested positive with COVID, and thankfully, nearly 450 have recovered and returned to work. But the coronavirus has not spared our department from its most devastating effects. We've had more than a dozen firefighters hospitalized at various times over the past few months, battling serious cases of the virus. And sadly, over the summer, we lost firefighter paramedic Jose Perez due to complications from COVID. Jose Perez was only 43. The post-Thanksgiving surge has also hit the LAFD with higher numbers of firefighters testing positive and forced to quarantine. But we do see the vaccine as a light at the end of a very long tunnel. The LAFD has been allocated doses of the Moderna vaccine, which will give our firefighters protection against COVID-19. This protection will extend beyond our firefighters. It will extend to their families, their peers, and the people of Los Angeles that we serve. All of our firefighters are either emergency medical technicians or paramedics, and more than 85% of all our calls every day are related to emergency medical service incidents. At the start of the pandemic, we quickly implemented new procedures for PPEs at emergency medical incidents, as well as new sanitizing and health procedures in all of our 106 fire stations. These policies continue today. But the COVID vaccine is the first opportunity that we have to turn the tide against this deadly virus. Providing the vaccine to our firefighters is a complicated team effort, requiring the coordination of the Mayor's Office, the Los Angeles Fire Department, the LA County Department of Public Health, and our partners at CORE, which stands for Community Organized Relief Efforts. I'm grateful for all of their efforts, and I am especially proud of the hard work and determination of the men and women of the Los Angeles City Fire Department as we protect the people of Los Angeles. Thank you.
Thank you, Chief, and thank you again for the extraordinary work you've been doing. I'm going to now give a few words in Spanish as well, and then happy to answer questions from our press pool. Estamos aquí con el jefe del Departamento de Bomberos, Ralph Terrazas, en la estación de bomberos número 4 en Downtown, para observar cómo se administran algunas de las primeras dosis de las vacunas para prevenir COVID-19. Estas vacunas están por los increíbles bomberos y paramédicos del departamento de LAFD. Y estas son las personas que siempre están con nosotros cuando ocurre un desastre. Los que corren peligro para mantenernos seguros y proteger nuestras vidas y propiedades. Y estas son las personas también que serán entrenadas para administrar la vacuna COVID-19, comenzando con nuestros trabajadores de atención médica de primera línea, que han trabajado tan duro y se han sacrificado tanto en el 2020, este año horrible. Estamos viviendo en un tiempo muy doloroso, un tiempo de miedo y un tiempo de profundo dolor, y para todos los angelinos que han perdido a un ser querido a el virus. Así que en este momento en el que iniciamos el largo camino hacia la recuperación, celebremos un poco el fin del año con este momento brillante. El martes pasado, el LAFD recibió alrededor de 3.200 dosis de las vacunas Moderna del condado para nuestros bomberos y paramédicos. A lo largo de esta pandemia, nuestros trabajadores de atención médica de primera línea y los primeros socorristas han estado allí para ayudarnos, tratando pacientes y salvando vidas. Con eso en mente, por favor, haga su parte. Evite las reuniones y limite las actividades no esenciales. Use sus máscaras cada vez que salga de su casa y siga las guías de salud para mantener a nuestras comunidades seguras y saludables. Y si cree que ha estado expuesto a COVID-19 o si no se siente bien, por favor hágase la prueba en uno de los 5 sitios de prueba móvil o los 5 sitios con acceso en persona. Las pruebas son gratis, como siempre, y están disponibles para todos los residentes del condado de Los Ángeles, aunque no tengan síntomas. Finalmente, gracias a este departamento y gracias a la gente de esta ciudad por sus acciones y por la esperanza de un nuevo año. With that, happy to answer questions.
Thanks, Mayor. My name is Faith Pino. I'm a reporter at the LA Times. But I've got a question here from Claudia at KNX News Radio.
Claudia, KNX.
She said, a lot of people are asking you to put a stop to street cleanups that displace homeless people amid the worst of the pandemic. What's your response?
Sorry, I couldn't quite hear. I heard homeless and, yeah, go ahead.
A lot of people are asking you to put a stop to street cleanups that displace homeless people. What's your response?
I don't believe in cleanups that displace homeless people. I believe in cleaning streets for folks that are unhoused, to make sure that not only there's access for folks who are housed, but to make sure that we have the ability to take disease off the street, to make sure that there's trash. You and I have trash days that we know about. Ideally, we bring services, so there's showers, there's services, there's housing, there's testing for COVID-19, and there will be vaccines one day soon. So to me, one of the basic duties of our city is to make sure that there's cleanups, but these are not to displace people. We need to only place people into housing. We try to do that by bringing those services at the same time, and we'll continue to. I know also council members do that individually. Half the teams are theirs, but I hope that we will all develop those protocols together to make sure that we have the most humanitarian approach to these, and the purpose is not displacement, it's taking care of sanitation.
Second question from Claudia. She said, we're hearing concerns about the lack of enforcement of the county's mask mandate on public transit. As chair of the Metro Board, do you think mask wearing should be enforced on Metro, especially given that so many essential workers depend on buses and subways?
We hear that anecdotal evidence, and we've trained all of our operators, who we certainly don't want to turn into law enforcement, nor do we have enough law enforcement to do that, to make sure that we encourage, not with a, hey, here's a penalty, but here's a mask. And that's something that we've looked at doing inside Metro. There's anecdotal evidence of that, but when we've surveyed it, we've had a very high level of mask usage. I've said from the beginning, we're not going to be able to simply enforce our way out of this, but we do have folks who are exposed to our operators. We do have folks who have no choice but to use transit, and they're exposed as well. So we'd encourage people to do that, and if we do find a level of that, we won't hesitate, but it's always warn first, give somebody a mask, then if somebody absolutely refuses, that would be the last case scenario.
Thank you.
Sure.
A few questions for me. So just so I understand correctly, I wanted to confirm. So the LAFD is going to be vaccinated this week and next week in
Correct.
sort of 2 chunks. And
The first dose, yes.
the first dose, right?
Yep.
And so that's all 3,400. You said members of the LAFD.
It's as many of them as sign up. It's voluntary right now, but I think in the survey, the first 1,400 people that surveyed, there was about 90% said that they would. So.
Okay, got it. So in 2 weeks, the goal is that pretty much everyone in the fire department is going to have the first dose.
Correct. Pretty close to.
Okay.
It won't be 100%, but maybe 90%, something like that. Yeah.
Okay.
And certainly all the ones on the front line who are responding to medical calls. So.
I believe someone said that the vaccines were delivered last week, either Tuesday or Wednesday. Can you talk about what happened in the interim few days?
Sure.
I know we had a holiday disrupting the timeline.
That's correct. I believe it was last Tuesday, and we had already tentatively scheduled today as the kickoff. Training occurred this morning at 8 a.m., and we had about 150 people trained up to administer the vaccine. We're fortunate. We have 1,000 medics, and we've been empowered by Department of Public Health to use our medics to vaccinate our firefighters. So since that day, that Tuesday we got the doses. We've had Christmas Eve and Christmas, and today was our official kickoff.
Got it. Thank you. Where were the vaccines stored in the interim time? Was it at these facilities?
No, we do have the required cold storage facilities at department facilities.
And for either one of you, is this pretty much tracking with your timeline of how you anticipated vaccines would be rolled out among city employees?
Well, I'll let you handle that.
It depends from when. Like, I mean, we all had ideas, early in the year and things like that. Certainly, I think in this last part of the year, it's because of the pre-planning that happened, it has accelerated as quickly as I had hoped, for sure. I would have loved the vaccine, obviously, to arrive earlier, but it's the earliest we've seen in human history for something of this size. And the logistics so far are working out quite well. I think there was a lot of worry about how cold. Certainly the Pfizer one needs to be stored colder. This is great to get the Moderna one rolling at the same time. So I'm satisfied that we can take an entire fire department, and within a month, they will be vaccinated.
Thank you.
Okay, that it? All right. Thank you all so much. Thanks for tuning in. See you soon.